Welcome to another episode of Weight Loss with Dr. A.
Hey guys, welcome to another episode of Weight Loss with Dr. A. And today I have a very, very special guest, and probably most of you guys have seen her. She is our nutritionist here at our hospital, at Endo Hospital, Erica Martinez, and she's been with us for quite a bit. You've probably seen her on, well, here and there, quite a bit of our stuff at Endobariatric. And today we have a very, very hot topic, which is talking about keto diet and vegetarian or vegan diet. And the reason I brought Erica to the show is she's very well capable of explaining all this to you guys, but I want Erica to go back and forth maybe with some ideas that I've seen my patients do. I personally have tried both. I was a vegan for 3 years. I've done keto for 3 years, and of course it's for you guys. It's the more we can get you guys information for you to be more knowledgeable and apply to get the best or the most out of your weight loss procedure or just weight loss in general. All right, so Erica, we'll go ahead and say hello, and we can start off with maybe a definition of what keto would be, like keto diet.
Okay, well, hello everyone. My name is Erica Martinez. As Dr. A said already, I'm the nutritionist for the Endo Hospital, and I think most of you know me for the tip of the day, but I really like the experience of having the podcast because I feel it's a little more informal, a little more casual, and it's more like a friend-to-friend kind of talk. So to begin with, the keto diet, I think it's very popular amongst the patients, and keto pretty much means high fat. Is 70% of your calories or 75 from your calories coming from entirely fat. Then you have some of the protein, which is about 20%, and you only have about 5 to 10% of calories to play with carbohydrates. So it's essentially a very high fat, low carbohydrate diet.
Yes, so it's very important you guys understand that doing a keto diet does not mean doing a high protein diet, which is totally different, all right? Keto diet is high fat, mainly. Now, sometimes it does disturb me quite a bit, Erica, that nowadays, I mean, you scroll down through Facebook or Instagram, and you see all these ads regarding keto and keto this and keto that, and people I think they're just like trying to make a living of trying to make you think they just rediscovered something amazing. Keto has been around since the 1930s, 50s. So keto has been around for us for quite a bit, all right? Actually, Dr. Atkins, the Atkins diet, he described it quite a bit ago. Please understand, keto is not a new concept. Keto is not high protein. Keto is high fat. And of course, we sacrifice the carbs, all right? And also important for you guys to understand that there is not something specifically, specially, or something that you really need to buy from these guys and these ads that you see on Facebook to do a keto diet, right? Mm-hmm. What do you have to do?
Mostly with keto is focusing on the fats, as I said already, but we're focusing on the good fats. For example, the seeds, the nuts, avocado, some oils, and as well having some of the meat. But the meat, it has to be a little bit more on the fatty side. It's not as much as chicken breast or lean cuts. It's more like the chicken thigh, the chicken leg, having a little bit of fat in your meats. So I guess if you scroll through Pinterest, which is the most is the most common source where people get their information with keto and the recipes. I see a lot of combination, mostly eggs, cheese, avocados, and bacon.
Yes, where do you get the bacon? That
Yes.
bacon has to be intuitive, of course.
And I guess that's why the patients feel so in tune with that kind of lifestyle, because in most diets they ask you to leave those things.
Yeah.
And that takes us to the point where food is too bland, and I guess keto, it's very popular because it's very flavorful due to all the fat that you are consuming.
Yeah. I think by the time a lot of the patients, I'm going to be talking about now on surgical patients who decide to have weight loss surgery, my patients. A lot of these patients have already tried a whole bunch of diets. A lot of these patients have tried paleo diet, low calorie diet, balanced diet, keto diet.
Military diet, which is very common too.
Exactly. And they do work. A lot of patients lose, throughout these years, over a decade that I've been doing this, a lot of patients lose quite a bit with a keto diet, these patients. The thing is, they need an emergency brake always on to help them keep it off. That's where the surgery comes in. Over 12 years ago when I started doing sleeves, we thought maybe just a regular balanced diet would do. Yeah, patients lost weight. But I noticed about 10 years ago that when I submitted a patient under a keto diet with a sleeve, the results were absolutely outstanding.
Yes.
Amazing. Why do you think?
It's mostly because, the stomach has been already reduced in size, and we have to keep in mind that out of the carbohydrates, proteins, and fats, fats are the ones that are the most calorie dense. They fill us up a little bit more than carbs and protein would. So it's very normal to see that even though you're managing very tiny portions, the patients tend to feel way fuller just because of the effects of fat in the body.
True. So listen, guys, when you eat fat, you will be less hungry for more prolonged time. It's very important you understand this. When you eat carbs, you'll have hunger sooner. All right, fats do this. When you eat healthy fats, guys, all right, healthy fats. When you eat fat, you will be fuller, longer, with less hunger, less frequent throughout the day, correct? So what do you think, what does keto diet claim? What do they say? What do people say who push keto diet?
What I have seen the most is that besides keeping you fuller for longer, which is a total proven fact, what I have seen the most is the claim that you lose weight very fast. And it is true, but it is mostly, at least the first few weeks when you are on the keto diet, is mostly because of the water loss.
Yes.
Yes. We have to keep in mind, and I think it's something that patients tend to forget. They see the scale moving very fast and they think it's extremely effective, but we don't really think about what is actually happening in the body. So what happens is that when we eat carbs, the carbs bound to certain amounts or grams of water, and they are retained in your body. So at the moment that you start giving up the carbs and that your body already used all the carbs that we have stored, you're pretty much losing a lot of water weight, but doesn't mean that you're actually losing fat like a lot of people think they are.
Yeah, so it's very important you guys understand, when you start doing keto, you'll see results really quick. And as Erica just mentioned, the scale moves very fast, which is very encouraging, and you like seeing that scale move, of course. But yes, you are depleting your carb glycogen actually from your body, and with that goes quite a bit of fluid with it. But let me. I know you go deep in this topic and everything. Let me explain, if I say it correctly, let me know. I just want to explain to you guys how this works. When we say keto is because we're not consuming enough carbs, and your body actually needs sugar, needs carbs, but your body starts producing these carbs. Since you're not intaking them, your body starts producing these carbs from your stored fat. When your stored fat gets metabolized, it is able, you can use this as fuel for your body, correct? And that is where you're in the keto state.
Yes, because you produce those ketone bodies.
Correct. So you are training your body to actually produce glycogen, produce sugar for your body to use with stored fat, and that's where you start losing all this fat stored in your body. Now if you add that, which I like to call it more chemistry, so it's not so much like a low calorie diet where 1 + 1 = 2, and if you don't eat much, that means 1 - 2 = -1. That means you're losing weight. That would be like more mathematical. And what we're doing here with explaining the keto is more chemistry, all right? If you add that chemistry part to a restrictive atmosphere, which would be the sleeve, so you're adding the mathematical part, which patients can't eat much, and the chemistry to the same patient, the results are very, very amazing and good. What do you think maybe a negative aspect of doing keto would be?
Yes. So, for example, there is a few situations in where keto is not really recommended, and one of them is diabetes. When someone is diabetic and that they use insulin, it's not really a good idea to try to go keto, because that is just gonna aggravate hypoglycemia, so when your sugar drops. As well, it's not really recommended for pregnant women, and neither for people with kidney or any kind of liver conditions. The side effects are usually either diarrhea or constipation. I think those two are pretty common, and constipation is mostly because of the lack of fruits and vegetables that it's in those kind of diets. So there's not a lot of fiber, there's not a lot of bowel movements. As well, we can increase the acidity of our body. The ketone bodies are pretty acidic, so that they can change the chemistry of our body in the long run if we keep it for too long. And as well, there can be a potential heart disease or an aggravation on a heart disease, just because a lot of people think that just because this diet is high fat, it means that they can eat a lot of saturated or bad fats. So they eat more fried foods, or they just eat bacon too often, or they just don't do the right combinations of fat, and that can cause some kind of heart problem.
All right, so I'm going to do a little parenthesis there. I have seen quite a few studies that say that what you're actually stating, that if you do a keto diet, you're more prone to having heart disease or diseases related to arteries being clogged up, yes. But then you have the scientists that actually defend keto, and they state the contrary. And I have also seen studies where keto, without the carbs, just doing keto by itself without the carbs, it is not, your arteries are not affected, so you don't see those results. What they say is normally the combination of both high fat with the carbs, it's terrible. It's terrible, you know. So that's where you're getting more problems down the road with artery conditions. The other thing is, I want to add another situation where keto is probably not recommended. I learned it the hard way, guys. So high performance athletes,
Yes.
that require bursts of action. I'll give you an example. A sprinter, 100-meter dash runs, cyclist. I used to do like more intense cycling, and those types, swimming.
Yes.
Marathons, maybe not the ultra marathons, the long distance marathons, because now we're having these ultra marathon runners, like 100-mile runs. They're getting trained. They're getting their bodies trained to using ketos. Keto. They're doing keto diet because now they've got their body adjusted to burning fat for longer periods of time without the need to stop and eat more frequent, and they can keep on going and running. So ultra marathon. Well, that's another topic there, another category. But sprinters. You're talking about athletes that need a really fast burst. You know, these athletes need carbs.
Yes.
They need carbs, so they really can't do the keto diet because carbs in your muscle, they'll make you act quicker and respond faster rather than being in a keto state. So I learned it the hard way. I was doing keto probably about 3-4 years ago. And we were doing a very long run. It wasn't a 100-miler. It wasn't a century ride, but at least we're going to be riding 60-70 miles. And all of a sudden, I started feeling a little tingling in my arms, my hands. This tingling continued to my legs, and all of a sudden, I experienced something that the athletes call hitting the wall. Hitting the wall, guys, terrible feeling, terrible sensation, all right? It made my body stop at that moment and not being able to continue, all right? And the reason is, if you're gonna be doing that type of sport, your body really needs the carbs. You can't be doing a keto and doing these sports that really need the burst, the really quick action, like a cycling sprinter, like a running, like all these sports. So that is another condition I wanted to throw out to you guys that I personally learned the hard way, and it is not ideal. So what I want to throw out to you guys is these diets work because I think they are really real food. They are real food, not processed foods. And whenever you're eating real food, it works. But I want to point out that not every diet is good for everyone.
Yes.
This is very important. So that is where Miss Erica comes in. That means your nutritionist, your specialist can educate you a little bit more on what to do and what not to do, what to follow and what not to follow. Please don't go on an online board and because somebody's posted there they're doing this or that, you're jumping on board. That's very important.
And something very important to remember too is that even though keto is very seen right now as a weight loss diet, it has been used mostly for people with seizures, Parkinson, and Alzheimer's. So it's not necessarily, it didn't really start as a weight loss kind of thing. It was more against certain diseases.
Yes.
But then people took it as a weight loss kind of diet.
Yes. I agree because back then they thought that if they would change the person's pH, it would create a certain effect on the patient or on the disease they were trying to target. Anything else you want to add on the keto diet?
A keto diet mostly will not include anything like fruits. If it's fruit related, it's mostly the raspberries, blueberries, strawberries, so mostly the berry kinds, just because they tend to be a little bit lower with the carb count, but still it is very limited in fruits and vegetables as well, not kind of any potatoes, rice, bread, soda, juices or beer, which I see a lot of people struggling when they want to go keto, is the fact that people enjoy drinking every now and then, and alcohol tends to be, most types of alcohol tend to be a little bit higher with the carb count.
Yes. I in particular, I don't do beer. I don't like beer much, but when I have a party, when I have, or we're hanging out with some friends, tequila is a good option. Everything that has alcohol, has carbs,
Yes.
has a certain amount of carbs. But as you say, beer has the most. Good options with the lower or the least amount of carbs would be tequila, vodka and whiskey.
Yes.
Yeah. So that would be more straight drinks, more than
Champagne too, I think.
more than prepared drinks, right?
Yes.
Another aspect before we jump into vegan vegetarian is what you mentioned about constipation. The first time I did a keto diet or a high-fat diet, I suffered with that. Yeah, I suffered with that. Suffered so much I didn't understand why, and I added some Metamucil, some fiber. But nowadays, when I did the switch from vegan vegetarian, which is a very high fiber diet, and you won't suffer constipation at all, jumped over to keto diet, it reminded me. I go, damn, I didn't remember about the constipation here. But nowadays I understand a little bit more, so now I'm able to eat more vegetables. And by the way, guys, there are some vegetables that have more content of carbs. You're gonna say, what? There's vegetables? But they're vegetables. Well, the same thing Erica said a few seconds ago. Even the fruits that you may say, well, eating fruits is healthy. Yeah, it's healthy, but does not go with this diet in particular. And now I get the hang of it, of balancing off, like at least 1 or 2 meals a day, I'll have a salad. So that, of course, gets more fiber in me and helps me out with that. And now I've got it very well balanced. But yes, it is a very, very common side effect.
And more than anything, I guess people get confused with the idea of carbs because we just see carbs as this bad thing. And carbs, we mean mostly processed carbs. The bread, the buns, everything, the pastries, all of those stuff are very, very bad carbs. But regarding vegetables, a potato does not have the same amount of carbs that a zucchini or lettuce would. So focusing mostly on green vegetables, we will have a lower carb count than if we are focusing on the wider side of the spectrum with for the example, the potatoes, the jams, and all that.
Exactly. So I personally avoid out of those, like sweet potato, regular potato, carrots, some of the stuff that I tried. Corn has a very high carb count. But yeah, it's a matter of just learning, reading, and researching a little bit more. The other thing is, I want you to see that I struggle with the weight loss. I deal with the day to day and work on a day to day. And it is important for you to understand that you have to learn to do this. You have to learn that if you let go, it's just deemed to be it's not going to work. All right, so you got to work with it every day. Watch what you're eating, balance it off, and it becomes sort of like a habit with time. So I invite you to just analyze and see what you can start changing. I'm not saying you have to do keto. I'm not saying you have to go vegan, go really intense and the whole 9 yards. It was a slight parenthesis here for you to watch what you're eating, and maybe you can switch a habit here and there. All right, so well, before we jump, one more thing, promise Erica, one more thing. The other thing is, maybe you can tell us a little bit about the side effects the patient may have right when they decide to go deep and say, okay, now I'm gonna do keto. Maybe what signs, symptoms can they experience because of this?
Mostly, I think the main problem when people want to do keto is the fact that they're not educated enough. They just get so scared of the carbs that one day they just wake up and they're like, I'm gonna remove all carbs from my life. And so you start very aggressively and the body takes it like that. So the main thing that people experience is the keto flu, which is pretty much just getting like the symptoms of a regular flu. You start feeling pretty lethargic, you start feeling pretty tired, sometimes even some dizziness going on. So it's just experiencing the flu symptoms, but it's due to the lack of carbs that people just removed right away instead of going gradually removing carbs little by little.
Guys, it happened. I mean, first time I went keto, I mean, I had a headache go on for 2 days. I was like, what the hell is going on, you know? So it's just to let you know your body is adapting. My best advice, as Erica is saying, go research it, get knowledgeable on this, and go easy and steady, and your body will adapt. Either you go slow or either you go fast, your body will adapt. But if you go fast, you are more prone to having some side effects.
Yes.
All right. Now, okay, let's talk a little bit about vegetarian vegan diet. What's that different with versus the keto diet?
The main difference is that, well, it's the total opposite pretty much. So in a vegetarian diet, you are including the carbs, you're including the fruits, the vegetables, the nuts, the seeds, but there's different types. Vegans do not include any kind of flesh. No meat, no poultry, no fish, nothing like that. But the vegetarians, depending on the type that you decide to be, you could include eggs, or dairy, or both.
Correct. Correct. Now, on this diet, we are talking about totally the opposite, as Erica's saying. This is a very high carb diet.
Yes.
The keto diet is a low carb diet. Vegetarian vegan is a very high carb diet. What do they claim? What does vegetarian vegan diet claim?
Well, mostly it is the vegan. I see it most as an ethical kind of view. A lot of people that go vegan is mostly because of the way that the animals all being treated. But vegetarians, I see it mostly for the weight loss kind of thing. Since vegan, it's pretty radical of a change. Vegetarians, they say that is way healthier, is less less anti-inflammatory.
Yes, they have you have less inflammation as well, so you're more alert and more steady throughout the day. Yes. That's the main reason I did it last time. It was because I wanted a more productive day, a more steady, energy-paced day. Yes, I mean, I personally, I totally respect people who do it for the ethical standpoint. I was doing it more for the health standpoint here. I also agree that, as you mentioned, a vegetarian diet has seen to be a more balanced, better option for the human body. That's where the Mediterranean diet comes in, because it's a more combination of it, right?
Yes.
Mediterranean, more the Barcelona area, more the Italy area. It is more olives. Has quite a bit of salads, and also has quite a bit of, well, a little bit of fish as well. So it also balances off. It's more like that's the Mediterranean diet, more like a vegetarian diet, right?
It's kind of like a mix because they still have a little bit of the higher fats. They do have the oils. They do have a little bit of the fatty fish, but still they have a lot of fruits, vegetables, and grains.
Exactly. So, what to do now? What to do?
Well, I think it really depends on what the patient likes once they decide to go on a diet. Every time I have a patient, I don't try to change completely their lifestyle. I don't try to change what they like. If someone tells me I don't eat fruits and vegetables, I try to work around that and try to include a few, but it has to be more like a progressive kind of inclusion of the thing. I think there's a lot of diets. We all have seen books, Pinterest, you go into there and you find 10, 20 different diets, and I guess it's where people get confused. Why are there so many diets? And I think it's because we're all looking for that one that it will change our lives. But I just really think it depends on what the patient likes, what the patient is able to sacrifice and willing to sacrifice. And to understand as well that it's not just necessarily weight loss, it's as well your health, is how you are feeling throughout the day, because you can be doing the military diet, which is extremely extreme, and it's very restrictive, and yes, you do lose a lot of weight, but you are not feeling really good throughout the day. So it's also caring about what is going on the inside, and by inside I mean how everything is working inside of us, our organs, and not just looking for an aesthetic per se. So I think people can go vegan, people can go keto, but as long as it's a very educated decision, and as long as patients are following it good enough, they will get results.
Yes. I think as long as you're eating real food,
Yes.
and as you say, some people, I mean, some patients come to me and say, well, I'm looking into weight loss surgery, but I am vegan, right? And we totally respect that, and they can continue being vegan down the road. Now, there is a misunderstanding. You may be thinking, well, how come they're vegan and they're overweight, right?
Yes.
Well, the thing is, drinking Coke is vegan. I mean, you can do the college vegan, which is a Twinkie. I mean, Oreos, they're vegan, right? They don't contain animal products, which is, but it is not ideal. So, but if you're eating real food, I mean, real fruits and vegetables, more plant-based, well, that would be phenomenal.
And it's the calories as well. I think people, they just want to find something where they can eat everything they want in all the quantities that they want and not gaining any weight. And we have to keep in mind that even if you're eating the most nutritious foods of the world, if you overdo it, your body is gonna find a way to store it, and it's usually stored as fat.
I'm going to take that comment right now and remind you, because now we have, I mean, our century, our current time, we have a obsession with protein. And they think that if you eat protein and you're having protein all day long, that you're going to be perfect, all lean, all muscular, and not store fat, which is an error.
Yes.
If you eat, what Erica just said, if you eat an enormous amount of protein, your body will process
That's fat.
and it will not know what to do with it because you're not demanding that much protein intake, and it will store it as fat. So it's very important for you to understand that not everything in excess, you will not be able to eat, as Erica's saying. I mean, if you eat even plants and vegetables in very large quantities will make you gain weight.
Yes.
All right, so it is important for you to understand this. The other thing is sticking to real food. The other thing is I want to mention, you guys, is anything that you grab at the supermarket and has a nutrition facts label on it has some sort of chemical processed thing done to it, right?
Yes.
I mean, if you go to the produce department, and nothing will have a nutrition facts label on it. If you go to the meats and dairy and cheeses and everything, you will not, I mean, the real deal, you won't have a nutrition fact stick to the package or to the ribeye, right? So so it's important for you to look out for nutritious real food. The other thing is, if on a nutrition fact label you see names you can't even pronounce,
Yes.
has been processed in a laboratory. So I would stay away from that as well.
And hopefully later on we can talk about the coding, the nutritional labels, because the companies, they do make it a little bit harder for the average person to understand, and I guess it's just for us to fall for the marketing and everything. Yes.
All right. Well, anything else you would like to add here? I think it was a great podcast. I think our main deal or idea was to explain to our listeners and viewers what to define.
Yes.
What's keto, what's vegetarian, vegan. We are not suggesting you guys go wild and jump on board with one or the other. I would suggest you contact your nutritionist for the best advice here. By the way, Erica, where can our viewers find you?
The viewers can find me at EndoFoods. Mostly is where I upload some recipes.
That's Instagram.
And that's Instagram. EndoFoods.
Yeah.
Yes. And as well, the patients can contact me in my email. It's going to be nutritionist@endobariatric.com.
Very good. So there you have it, guys. You can find Erica at EndoFoods on Instagram, which, by the way, I follow, and you'll love the recipes that are there. And Erica does her cooking there and does her cooking show as well, which is very fun to watch and get ideas from. And also at nutritionist@endobariatric.com, which is your email. Very good. So, conclusions, the definitions are out there, guys. Don't jump on board. Not one thing fits all. Look at your lifestyle. I personally had a little bit more struggle with being a vegan when I was traveling. Nowadays, doing keto, anywhere I can find a salad, or I can find a steak, or chicken, or I got more options. Breakfast is easier being a vegan than being keto. Breakfast is easier having granola, having good fruits, etc. But it's harder being keto. You're looking at omelettes, you're looking at bacon, you're looking at cheese, more complex, not so much on the go.
On the go, yes.
And I had trouble there with that. But pretty much anywhere you can find a good steak or chicken or a salad. So there you have it, guys. We wanted to explain a little bit about both scenarios here for we can clear some doubts for you guys. And of course, you're always welcome to send us your comments, questions on the comments section. We'll look at them and go over them personally. And thank you so much for being here with us. All right.
If you're interested in knowing more about the gastric sleeve, visit endobariatric.com.